So we're talking about glutes and not just the big glute muscle, the glute max as we think, but the glute medius is something I'd like to point out to you guys because it's something I see a lot in the office. If you look at the anatomy here, we're looking at the pelvis from the back, and just on this right side you'll see that big glute max muscle. The glute medius is actually tucked underneath and it comes out to the side and it attaches to the outside of the hip joint right here. So top of the hip crest to the outside of the hip joint. It's responsible for stabilizing the pelvis while you walk or while you're standing for a prolonged period of time. The other thing it does is it's part of the muscle group that will move your hip out in this direction. We call that abduction or abduction. So it's a hip abductor. And that's exactly what it's doing while it's trying to stabilize you as you walk. So if I'm walking and I can't use my glute medius either because it's turned off or because it's too weak, what's going to happen is rather than keeping my hips level like this, what it's going to do is when it's weak or when it's not firing, it allows my hip to cock down like that. So on the other side, if let's say this left glute medius is weak for me, I'm going to cock towards that left side like that. So what happens each time I take a step is this kind of like swing gait, right? So if this is you or if you know somebody who kind of swings back and forth like that, usually they're going to have chronic SI joint problems or low back pain until they get that adjustment to stabilize the pelvis but also strengthen the glute medius so that the pelvis remains level each time they walk. We want to work on that for them. So what you want to do if this is you is get adjusted, obviously, because you want your pelvis to be balanced before you start building muscles on top of it. But hip abduction or hip abduction right here is what you want to do. And if this is weak on you, like it is on me, you don't need weight. You really don't need resistance. You don't need to tie a Velcro thing to a pulley system. Body weight is just fine. And believe it or not, you're working both glute meds with that exercise because you don't want the other side to cock as you do this, right? So you want to engage the glute med on the opposite side and then use the glute med to abduct on this side. And then switch it up and make sure you're getting both sides. If this is real weak, it probably also has trigger points or adhesions, and that can refer pain in different regions around the pelvis. So get like a lacrosse ball or something pretty dense or like one of those foam rollers, and what you're going to do is just hit that part of the butt right here. So not straight on the back, but kind of up here on the side and on the back of the hip joint. You're going to roll that until you find the spot that really hurts, and you're just going to 6 out of 10 pain, work it out until it releases, and you'll find that you're able to do these exercises better and your hips will move better. You can hold some of these adjustments in the pelvis.